Thank you for joining Red Deer Public Library for Health Café. This presentation will be recorded and you will be able to view the video for this and previous Health Café sessions on the Red Deer Public Library YouTube channel. Today's topic is living well with an elevated weight. Family physician, Dr. Sereyrath, Ngeth, recreation therapist, Lynsey, Hermary, and family nurse Jonah Saringo will discuss weight stigma and treatment options, including lifestyle, medication, and surgery. Thank you. I will pass the screen to Lynsey.
Okay, welcome everybody, and thank you for tuning into our Health Cafe today. Living well at your best weight. So I'm going to begin by sharing some objectives for our presentation today. And so the first one is that we want to help people really feel empowered to influence their weight in a way that encourages health, but also happiness, which isn't something that always has historically come along when it comes to influencing your weight. So that's going to be a big focus today, is how you can do this in a way that feels joyful. We also want to provide you with up-to-date evidence on weight management. And so we will be sharing information that comes from the 2020 Canadian Obesity Guidelines. And lastly, we want to address and reduce stigma around weight. So these are the social stereotypes and misconceptions that are common in relation to obesity. So to begin, we want to share with you the definition of obesity, which might be a little bit different than what you have had in your mind. So obesity is a prevalent, complex, progressive, and relapsing chronic disease characterized by abnormal or excessive body fat that impairs health. Okay, it increases risk of long-term medical complications and can reduce your lifespan. It requires an individualized disease management plan to treat. So the message here is that it's not yours to manage alone, which might be a common feeling for many people with obesity. Obesity is defined as having a BMI of greater than or equal to 30 kilograms per meter squared. So why do we gain weight? So the old message, which is probably the message that many of you have grown up believing, is that it's a simple mathematical equation of overeating and not moving enough. With that belief, there comes with a lot of personal responsibility attached, feelings of this is my fault. There's a lot of guilt and shame that are quite common with this belief. And so with the new science, we want to share the message that it's a lot more complex than that. There's a lot more going on. So it's a complex interplay of multiple environmental, genetic, biological, and socioeconomic factors that are in play. So the message here is that it's not your fault. And again, it's not yours to manage alone. It needs to be treated just like any other chronic disease would be treated. So to kind of further promote this message, I want to share this picture on the complexity of obesity. So this is a map. In 2007, a team of researchers mapped out all the numerous contributing factors to weight. So you can see it's just really not as simple as we might have thought. It's much more complex, and it's influenced by many factors that are often out of our control. And so today, we want to share with you and highlight the factors that you can influence to give you a sense of empowerment around living well at your best weight. And so with that, I'm going to pass it on to Dr. Ngeth, and he's going to talk more about this.
Thanks, Lynsey. So from a family medicine perspective, when we assess patients for obesity, we always, first and foremost, want to ask for permission to discuss their weight. Weight is a very sensitive issue, and not everyone is comfortable discussing their weight openly. So as family doctors, we always want to ask permission. And if patients are not comfortable discussing their weight at that particular visit, then I think it's quite reasonable to move on and ask them to discuss again when they are comfortable. Secondly, once patients are comfortable, we want to be able to assess them from an obesity standpoint. So we want to be able to assess their value-based goals that matter to them, and we can talk a little bit about that in the next few slides. And we also want to assess the degree of obesity. We can classify based on their BMI. Some physicians may also want to do a waist circumference as well, because that's also another independent risk factor for obesity-related health issues. We also want to assess, possibly if we can, the root cause of a patient's weight gain. So we'll also talk about that in the next few slides as well. And then there is another method of assessing disease severity by way of the Edmonton Obesity Staging System. It's not a system that I think we use often in family practice. So I'm not gonna go into that very much, but it's just another system to assess a patient's level of obesity and their health. And the next step after assessing is advising patients on the risks of the health consequences of obesity, and discuss the health benefits of obesity management. Next slide, please. So what happens when we gain weight? Not everyone with obesity will develop related health conditions, but some will. We know that the higher the BMI, the higher the risk of certain health conditions, and this includes type 2 diabetes, gallbladder disease, fatty liver disease, and gout, amongst others. So finding and treating health conditions early is best for your health and wellness. People with obesity and overweight tend to experience bias and stigma, which unfortunately can have a negative effect on physical and emotional health. And we as family doctors need to recognize that and help patients, guide them with this journey. Next slide, please. So what can we do to live well at our best weight? As I mentioned before, usually we try to determine the root cause of gaining weight or obesity. There are 4 aspects that we can look at. So mechanical, perhaps a patient has a bad knee and aren't able to partake in physical activity that could promote weight loss. So that's something we need to look into, a mechanical aspect of obesity. There are metabolic conditions such as low thyroid or adrenal issues that can also cause obesity. So this is something that we as family doctors need to look into. Mental health aspect of a patient. Some patients who feel sad or anxious don't have the motivation to exercise or eat better or live a healthier lifestyle. And this is something that we should also address if this is the case. And then just the social milieu. So if a patient hangs around in a crowd of of people who don't have the same mindset with their obesity and their weight, that may become a problem. Becoming aware of your weight bias and how it affects you is really important in that sense. So we know that if we're able to lose about 5 to 10% of our body weight, it can have quite a significant reduction in the effects of our of health-related conditions, as I mentioned before, especially high blood pressure, diabetes, and cholesterol. Next. So we should establish with our patients the goals of weight loss. And really, we need to be able to establish realistic goals. Some patients may believe that they're able to lose 20 or 30% of their body weight, and that's really exciting, but that might not be absolutely realistic. So establishing realistic goals is, I think, really important moving forward. The next goal is also to reduce and maintain the weight loss, which we have achieved. Other goals should include improving health and well-being for yourself. So when I say that, what I mean is, let's say achieving a weight where you feel comfortable about yourself, comfortable and good about yourself, where you take less medications, let's say for diabetes or for high blood pressure, or where you can keep up with your children, or you can walk where you can walk further to the park, or even sleep better. So it doesn't have to be a weight-based goal per se. It could be more like a lifestyle goal as well. Next slide. So I'm gonna hand it over to Jonah to talk about some of the things that we should be incorporating to help us lose weight.
So when it comes to healthy living in general, as well as weight management, lifestyle plays an important role. So we see lifestyle as the foundation to achieve this healthier lifestyle or healthier living, as well as weight management. So lifestyle includes nutrition, activities, as well as your mindset. So currently, many of the PCNs across Alberta already offers a workshop that was specifically designed to look at these 3 key areas. And this workshop is called My Way to Health. It's also previously known as Health Basics. So this workshop was developed to help you create a way of living that will work for you in the long run. Lynsey here will talk more about how to access this awesome workshop later on. But for now, I'll briefly discuss the 3 areas of lifestyle that can help with weight management, starting with nutrition. So when it comes to nutrition, nutrition can be very complex in the sense that if you look at Google and search nutrition, you have millions of different hits. When it comes to nutrition, hunger is determined by thoughts, emotions, hormones, and environment. And what we have to do is get support from healthcare provider so that we can deal with this different causes of hunger, right? So when it comes to nutrition, and with any behavior change, we need to figure out where we're at to begin with. So this is when we recommend using a food journal. Once we know what we're consuming, what we're drinking, we can make changes in areas we are not satisfied with. So what we recommend is people to reflect on journaling on a daily or weekly basis. So when it comes to reflecting on the food that you're consuming, this is not about judgment. This is not about shame. This is all about learning what we're doing and find out areas that we're satisfied with, as well as areas that we need to improve on. For the areas we're satisfied with, those will be considered the bright spots. So ask yourself, what about those areas that you're satisfied with within that day or that week? What about those days? What were you doing that helped you achieve that? And what we want you to do is replicate that, do it again, right? So because it shows that what you were doing when it comes to planning that day worked really well. The other end of the spectrum is looking for areas for improvement. Ask yourself, okay, what did I do today? Circle the areas where you feel like, okay, this can change. Maybe I can make little changes here, right? So that's the basis of the food journal, is to increase your awareness of what you're eating, consuming, and drinking. However, food journaling is not for everybody. There's some contraindications. So when people sometimes get fixated over numbers, or people with history of eating disorder or disordered eating, this may not be something that that will work for you. So what I would recommend is talk to your family physician, your family nurse, and see if this is something that will be of use or help for you. The aim when it comes to behavior change is making small manageable changes that you could sustain and not be just a fad for a few weeks or months. Next slide, please. The second part I want to talk about is the activity portion. Whenever we talk about activity, automatically people think about exercise, and I know that some people just do not like exercising. So what we recommend is start small, right? Like Dr. Ngeth mentioned earlier, make realistic goals. Maybe it's walking around the block after dinner or parking a little bit further away. When it comes to activity, it's not just the exercise, but also those non-exercise activities such as, you know, using the stairs, or vacuuming, household chores, or even, you know, like I said, parking for further away and walking to your location, right? And sometimes when we think about activities, specifically exercise, we tend not to schedule it in our calendar. So the recommendation is schedule those exercises because they're as important as any other appointment that you may have. If you need some help with this, visit the Red Deer Primary Care Network or talk to your family physician about the Go Get Fit app. And when it comes to sustainability of exercise and activity, you have to make it fun. You have to do something that you actually enjoy. If you were to tell me that the only exercise I can do is go for a run, you know, 30 minutes every day, I generally don't like doing the running. So for me, that's not going to be fun or sustainable, right? So try something new, invite somebody to join you, right? So if you want to try different activities in Red Deer, the Red Deer Primary Care Network do have a physical activity prescription where we work with different organizations and they offer free activities. For example, you could, if you get the prescription for physical activity, you could go to GW Harris and get 1 month free membership for you and a friend just to try it out. So it gives you a taste of different activities without you know, paying for it, just because we know that, you know, sometimes finance can be a barrier. The goal of activity is working up to 150 minutes per week at a moderate to vigorous aerobic activity. So increased activity may improve a lot of different areas of your health, not just the weight management area. So if you look at chronic conditions, if you look at hypertension or high blood pressure, diabetes, we can see improvement in those areas with achieving the 150 minutes per week. We could see an improvement in sleep, as well as increased positivity when it comes to a mental health aspect, right? So there's a lot of different areas where we can improve just by using exercise and activities to begin with. Can we go to the next slide, please? And the last piece is sometimes the one that we tend to forget is the mindset piece, right? So discovering your whys. So why is it important to you to live healthy? Why is it important to you to decrease or manage your weight? And what we want you to do is to really think about the why, because this why could be the key to motivation. So when it comes to goals, what we want you to do or recommend you do is set manageable goals that are actually important to you. It's not about your family physician's goal. It's not about your family nurse's goal. It's about what you want to accomplish, right? So if you have not succeeded in reaching your goals in the past, maybe we made too lofty of a goal. What we recommend is creating micro goals, meaning goals so small that it's almost guaranteed that you'll meet these goals. The reason being is that when we meet a goal, so it doesn't matter how big or how small the goal is, we feel good, we feel positive, and we're more likely to create and achieve other goals. However, there will be times when even when we create micro goals, we might not actually meet those goals. So what we recommend people do is practice more self-compassion when things do not work out as planned. We know that, you know, when it comes to compassion, we tend to be more compassionate to and for other people, and we're usually not very compassionate when it comes to ourselves. We're our own worst critic. So practice more self-compassion. You know, if you didn't meet your goal, forgive yourself, move on. Ask yourself, okay, what about that goal that didn't work out for me, right? Use problem-solving techniques through reflections so that you learn from those past experience, right? For example, my goal tonight is to go for a walk after dinner. Let's say after dinner, I just was too tired and didn't meet that goal. Well, what I can do instead is, you know, through problem solving, okay, ask myself, what is the best time of day that I can get my walk in and not feel tired? And, you know, usually lunchtime, it generally takes me 15 minutes to eat. And then I usually have about 45 minutes of no activity. So maybe I'll incorporate my walk then and see how that works, right? And as it relates back to eating, when you're doing food journaling, asking the why is very helpful, right? Because we need to know why exactly we're doing that behavior. So for example, I ate a bag of chips, you know, around 3 p.m. today. The reason is because I was feeling really, really stressed. Okay, now I know the reason for eating. Now that I know the reason, I could create a plan on what I can do instead. Okay, I know that when I feel stressed, eating helps for 5 minutes, but after 5 minutes, I'm still stressed. So maybe if this is an acute stress, maybe going for a walk will help, right? But if this is a stress that I feel often, this is a good chance to consider seeing a counselor, right? Maybe I need a little bit more help with stress coping techniques. And also when it comes to mental health, you know, if you have anxiety, stress, depression, or just body confidence issues, this is a good idea to talk to your family physician and maybe get a referral to a mental health counselor. So now those are basically the three things I want to talk about when it comes to lifestyle. Dr. Ngeth will now talk about other pillars of weight management that can help support your lifestyle behavioral changes.
So thanks, Jonah, for that. There are times when medications are an option to help promote weight loss on top of this lifestyle changes that Jonah had discussed. Keep in mind, though, that not all medications will work for every person, and there are specific criteria that is required to go on to medications for weight loss. So first, you need a BMI of greater than 30, or your BMI can be more than 27 with certain obesity-related health issues, including high blood pressure, diabetes, cholesterol problems, heart disease, sleep apnea, where you stop breathing at night, and even osteoarthritis. Next slide, please. So there are different classes of medications that we can use, one of which is oral or pills that we can consider. There are 2 of them that's available in Canada on the market, one of which is called Contrave. It's a combination of 2 medications in one. Bupropion is an antidepressant, and naltrexone is actually what we use for people with alcohol use disorder. The medication, the combination of the medication, it is designed to reduce cravings and hunger. It can help to reduce a person's weight by 4 to 5% in 1 year. There are some side effects with it. Most commonly, people experience nausea, headaches, and constipation. The second medication that's available in Canada by pill form is called Xenical. That's the brand name. And the generic name is called Orlistat. It is an interesting medication. It works in the stomach to help reduce fat absorption, dietary fats. It can reduce your weight by about 5% in 1 year. The side effects are not very good though. So I think this is a medication that most physicians would avoid using. You can develop cramping in the stomach, intestines, gas, fecal incontinence, which means you lose control of your bowels, and even greasy stools as well. So as I mentioned, the side effects are not great, and I think this is a medication we typically avoid using in family practice, but it is an option. Next slide, please. And then the next group of medication is injectables. So there are two particular ones that will be available in Canada. How it works is that it delays emptying from the stomach and makes you feel full sooner, so you end up eating less. Side effects that are common include nausea and vomiting, and others include low blood sugar and diarrhea. Interestingly, these two medications are actually medications we use in diabetics to help control their blood sugars as well. However, these medications are used in much higher doses to help promote weight loss. So the first one is called Saxenda or liraglutide. It's an injectable that's done every day, daily. And this medication can reduce a person's weight by 5.5 kilograms, which is about 12 pounds in 1 year. The second medication is called Wegovy or semaglutide. I don't believe it's available in the Canadian market yet, but I hear that it's going to come out hopefully in the fall. And it's an injection that you provide to yourself just once a week. And it can reduce a person's weight by almost 13 kilograms, which is about 28 pounds in 15 months. A study had shown that Wegovy, the second one, resulted in 9.4% more weight loss compared to Saxenda. So it works a little bit better. And next slide, please. So thus far, we've talked about weight management through nutrition, that is diet, and activity. And we also discussed psychological intervention. Jonah had gone through that very well. And I had discussed the medications that we can use to promote weight loss. The next pillar of obesity management is bariatric surgery. So usually patients require a referral to a specialized bariatric clinic to consider surgery. And this is usually considered probably more advanced and sophisticated form of weight management. So I won't go into much detail on it. Next slide, please. And since we are in the central zone, I thought I'd just include the eligibility criteria to be referred to the bariatric clinic in Red Deer. So you have to be aged between 18 to 59 with a BMI of 35 kilograms per meter squared or more, with severe obesity-related comorbidities. And these can include type 2 diabetes, high blood pressure, cholesterol issues, obstructive sleep apnea, fatty liver disease, heartburn, asthma, or even debilitating arthritis. Or your BMI can be 40 kilograms per meter squared or more without any of those obesity-related health issues. And you have to be a non-smoker, and you have to not be vaping for at least 6 months before we can do a referral. In addition, they prefer to see patients who do not have any severe or unmanaged mental illness. They want to make sure that is taken out of the equation, and family doctors really should be managing mental illness, as that can also help manage their obesity as well. Also, patients cannot be actively using substances, that is illicit street drugs, or have major cognitive impairments where they're not able to understand like the educational process involved in obesity management. And depending on the type of surgery that is agreed upon by the patient and the surgeon and the clinic, one can expect to lose anywhere between 50 to 80% of their body weight. And this averages out to be about 45 to 54 kilograms or 100 to 120 pounds in 12 months. So it's very effective, but at the same time, very time consuming as well. And next slide, please. So I will pass it over to Lynsey.
Okay, great. Thank you. So lastly, we just want to share with you folks the programs that the Primary Care Network and Red Deer have to offer you in terms of support. If you listen to this Health Cafe and are keen to move forward with some support to live well at your best weight. So Jonah did a really nice job of introducing our main workshop that we have. It's called My Way to Health, formerly known as Health Basics, if you are familiar with that. So this workshop, it's an 8-week long workshop that focuses primarily on the lifestyle section that Jonah was discussing. So mindset, activity, and nutrition. It's a group-based program. We are currently running it on the Zoom platform with plans to possibly run it as an in-person group in the fall. And it is a fantastic opportunity to receive that support that we are talking about in terms of the coaches in the workshop, as well as the other people, the participants in the class. Many people report it being a very safe, supportive, inspiring environment where they feel that they can make headway on their goals and change their habits so that they become a lifelong healthy habits to help them live towards those goals that are important to them. So in order to participate in the class, you can actually self-refer. You don't need to go to your family doctor to get the referral. So you can contact the phone number that's on the bottom of the screen, 403-343-9100, and request to be referred into the workshop. There's 2 different options. You can take a 4-week version, which is a shorter, more condensed version. And then, like I said, we do have the full 8-week program. So that is a really good option to receive some support. And many people enjoy the accountability process as we get people at the end of each week to write down what their goals are and how they can really take the information and put it into practice in a realistic way. Some other programs to support you. We have PCN recreation therapists like myself, who you can refer yourself to, or your family physician can refer you to. And that would be a great opportunity if you're really having some barriers around getting physically active, especially if you have some anxiety or depression that might be holding you back from participating in activities. The recreation therapist can work one-on-one with you to break down those barriers and really give you that support to move forward in a way that's going to work for you and your needs. As well, we have the mental health counselors, and so that would be a great option if you're struggling with body confidence, lack of self-esteem, anxiety, depression, anything that could possibly be getting in the way of you meeting your goals when it comes to your health and your weight. And lastly, we have our family nurses. And so they can be accessed through self-referral and again, through the family doctors in Red Deer. And that would be a great resource for somebody if you have a chronic disease like diabetes or high blood pressure and need some more one-on-one support. They can definitely offer you that and communicate well with your family doctor to make sure that everybody is on board and really giving you that support that you need. And so, yeah, if you have any questions about these programs, the phone number is there on the screen. Feel free to contact the PCN, ask questions, and possibly get yourself involved in any of these programs. So thank you folks for tuning in to our Health Cafe. We hope that this gave you some helpful skills and information that will help you to move forward and live well at your best weight. As well, I'd like to just send a reminder for the upcoming Health Cafe that will be on May 17th at 1 to 2 p.m. And the topic is outside for your mental health. Okay, thank you very much.